Why is the coronavirus outbreak more severe in the USA than in other developed countries? One big reason is fake news. It's everywhere. Controversial Sinclair broadcast group, notorious for dictating conservative content to some 200 TV stations, has published an online interview with a conspiracy theorist who claimed that Dr. Fauci created the coronavirus using monkey cells. Fox News follows the meandering Trump narrative religiously, and the New York Times reports that fringe Breitbart News racked up a reported 14 million views in 6 hours of a video featuring doctors telling us masks are unnecessary and hydroxychloroquine is the cure. Social media full of experts who seem to have gotten their MDs at Trump University. What is the #1 myth or misconception about this novel coronavirus?
Well, that it is just like the flu. It's not just like the flu. It's highly contagious, more contagious than some other viruses that we've seen. It's clearly deadly, and it is being passed by many asymptomatic patients without symptoms. And you do need to wear a mask. No question about it.
Much of the noise in the news lately is about vaccine. Encouraging as these reports are, it's not soon that we're going to be lining up for shots at CVS, is it?
No, listen, we're probably a minimum of 6 months away, probably longer. They have to test safety. They have to test, lots of people. We need to make sure they work. They are gearing to approve a vaccine that's going to be only 50% potentially effective, right? So we're not talking about vaccines that are going to protect 90%. We're talking about vaccines that at best will protect 50 at a 50% level. So, but we're going to wait for that. It's going to be a while, and I have concerns about whether this vaccine will work. How many doses are we going to need? How often are we going to need it? We probably will need it multiple times. We probably will need it yearly after that, maybe more often than that. So there's just so much uncertainty, so many companies racing to the end here. But I don't see it happening anytime soon, and I'm not even convinced that a vaccine is going to work.
Best case, suppose we get a vaccine tomorrow. We keep hearing that this coronavirus can mutate, as does the flu. Is it possible that when we do get a vaccine, it's going to be good for a year, and then there's going to have to be another vaccine developed for next year? And like the flu vaccine, there is a bit of educated guesswork each year, correct?
Correct. And I think you're right. I think it could potentially be the same here. And with the flu vaccine, you have this year where we're looking at we're in the northern hemisphere, right? We're looking at the southern hemisphere. We're looking at what viruses are there, the season ahead of us, and then we're preparing based on that. And sometimes we're right by a few strains, and sometimes we're wrong. But we don't know about the seasonality of this coronavirus, this novel COVID, right, 19. So the problem is we don't know if it's going to be a year that we're looking at for mutations. We don't know if it's going to be less than a year or more, right? So the flu, we have a lot of experience with. We know we can predict it a little bit better. We don't know. This is a completely new virus for us.
I'm Larry King. Questioning, listening, learning. I've always said I never learned anything when I was talking. It's important to listen. Question more.